So good morning, everybody, and it's my pleasure to announce that the Honorable State Minister of Health of Ethiopia has joined us, and I would wholeheartedly invite him to open this meeting. So His Excellency, Dr. Dereje Duguma, please, the floor is yours.
Good morning. Welcome to Ethiopia, your second country and your second city, Addis. Thank you very much for choosing Ethiopia and for joining this great nation. Distinguished committee members of the Coalition to Strengthen the HPV Immunization Community Project, distinguished Dr. Rose Delamini, WHO Deputy Country Director, dear participants and distinguished guests from all over the world, ladies and gentlemen, welcome to Ethiopia and to the beautiful Addis Ababa, the capital, diplomatic and the seat for the Africa Union. It's a great pleasure for Ethiopia to host this international symposium here in the capital city, Addis Ababa, and I'm also delighted to be part of this high-level event. And I'm honored to address opening remark on behalf of the Ministry of Health of Ethiopia and on behalf of myself. In this sense, my deep appreciation and respect goes to the members of the Coalition to Strengthen the HPV Immunization Community Secretariat and our partners. As we all know, cervical cancer is one of the most cancer and the cause of cancer-related deaths in women across the world. Approximately 530,000 women are diagnosed with cervical cancer around the world each year. Every 2 minutes, a woman dies of cervical cancer, and 87% of deaths from cervical cancer occur in low and middle-income countries. In sub-Saharan Africa, as you obviously know, cervical cancer incidence rate is the highest in the world, and the disease is the most common cause of cancer deaths among women in the region. In Ethiopia, cervical cancer continues to be the leading cause of deaths among women. An estimated 5,000 women die because of cervical cancer, while about 7,000 new cases occur every year. In keeping with our responsibility towards women and young girls, we seek to protect them from acquiring HPV through vaccination. Ethiopia is one of the countries that have introduced an HPV vaccination program, and we are fortunate to be among the leading African nations providing effective vaccines that protect our girls from cervical cancer. Vaccination against human papillomavirus, screening and treatment of pre-cancer, timely detection and prompt treatment of early invasive cancers, and palliative care have been proven to be effective strategies to address cervical cancer across the continuum of care. These interventions are embedded in the targets and indicators of WHO Global Action Plan for the Prevention and Control of Non-Communicable Diseases, support the realization of the 2030 Sustainable Development Goals, and are aligned with the global strategy for women, children, and adolescents' health. Distinguished guests, ladies and gentlemen, Ethiopia introduced HPV vaccination in December 2018 for a single-age cohort of 14-year-old girls. As the school enrollment rate of adolescent girls in Ethiopia is quite very high, the main platform to deliver HPV vaccination is through a school-based strategy, followed by outreach vaccination session for out-of-school girls. Mobile teams are also utilized in hard-to-reach and pastoral communities, and the school absentees will be referred to the nearby health facilities. Nationally, HPV vaccination program is outstanding agenda for the ministry in collaboration with other sectors like education sector and other stakeholders since 2018. Since the introduction at 2018 till before the era of COVID-19, the performance of first and second dose of HPV vaccination is 2.4 million and 1.1 million respectively. Currently, Ethiopia reached more than 4.8 million and 3.1 million girls with the first and the last dose of HPV vaccination amidst of COVID and other emergency situations respectively. As you can see, every year since 2018, our achievement is more than 90%, and we utilized campaign, and we have been working with our stakeholders, including education sector, media, and many other important stakeholders to achieve such high performance targets. So basically, awareness creation was one of the serious issues that have been undertaken by the ministry. We are able to convince our community, especially elites and also girls and their families. We have also approached Ministry of Education to support the campaign and to work with us. And moreover, leadership engagement at all levels, specifically at regional level, through regional LCB leadership and also through regional presidents. We were able to achieve big success in terms of vaccinating our girls. So our performance is quite greater than 90% over the last years. The health policy of Ethiopia boldly states that the health needs of women and children deserve particular attention. Women and children, especially recently adolescent girls and the boys, are of particular attention through our policies and the strategies that we are undertaking. The government strategy is to build up on the primary prevention activities, strengthen the existing service, including scale up of secondary cervical cancer screening and treatment to ensure service across the country. In line with this, efforts have been made to improve the low coverage of cervical cancer screening in collaboration with stakeholders through demand creation at national and regional level, capacity building, adoption of better screening and treatment technologies, and the continuous quality improvements. Currently, more than 1,100 health facilities, one facility per district. We have about 1,000 districts in Ethiopia are providing cervical cancer screening. And 3 specialized hospitals has been giving treatment by using VIA screening and cryotherapy treatment. And at more than 7 selected treatment sites, expansion is undergoing at the national level. LEAP service is provided by few centers, and we have 3 functional radiotherapy services. And in a nearby time, we'll increase the number to 7 university hospitals that will give holistic treatment for cervical cancer cases, including radiotherapy and chemotherapy. To date, over 500,000 women aged 30 to 49 have been screened with treatment coverage of 96% among those with precancerous lesion. So still the screening rate for cervical cancer is quite low, and we're working seriously on this matter to improve based on the targets that have been set by the government and also by WHO in terms of elimination. Immunization program remain the backbone of health system and offer the opportunity for truly progressive universal health care as an opportunity to strengthen health system. Furthermore, preventing cervical cancer offers an opportunity for the national economy and healthy community to thrive. In August 2020, the World Health Assembly adopted the global strategy for cervical elimination to eliminate cervical cancer. All countries must reach and maintain an incidence rates of below 4 per 100,000 women. I think you all know, and they have been discussing on this issue days back in Rwanda. Each country should meet 90% immunization, 70% screening, and 90% treatment rates by 2030, so that we are able to eliminate cervical cancer. And I should bring on this stage the milestones that have been set for 2024 for African member countries based on the discussions that happened days back. So we should vaccinate more than 90% of our girls in 20 member countries, and I believe other member countries will also try to improve their vaccination coverage, and we should be able to screen more than 25% in 10 member countries, and we have to manage to treat 50% of our precancerous and 25% of cancerous women with cervical cancer. So we should all work together. So we should share experiences, what worked very well and what didn't work. And I think this platform will be an excellent platform where we can discuss on research findings and to share the updates from different countries. We applaud the call to action by WHO on cervical cancer prevention and control with the goal of eliminating cervical cancer. This is an important step towards achieving the vision of a world where the number of women affected by certain HPV-related cancer is greatly reduced. We are committed to this cause and to the successful implementation of the HPV program, working with all stakeholders and partners in sub-Saharan Africa to ensure that this goal becomes a reality. Distinguished guests, ladies and gentlemen, While progress has been made in the fight against HPV-related diseases, more work needs to be done as HPV-related cancers still remain a significant public health burden in women. It's pleasing to participate in meetings where immunization experts and important stakeholders come together from across the continent and beyond to share best practices and experiences in HPV vaccination program. This can help to find sustainable solutions to strengthen HPV program, improve access, and lay a solid foundation for those that will be launching their national HPV immunization program in the future. As an African and global health community, we are on the cusp of something great in Africa, imagining a world where one day no woman should die unnecessarily from cervical cancer. We must continue to build on the wonderful momentum we have and the remarkable progress we have achieved. Finally, let's not forget that preventing this is about securing the future, not just for Africa, but for millions of African women and girls who are at the center of healthy and prosperous world. I now here declare this high-level event is officially opened, and I wish you every success in your deliberations in the next 2 days. And I know you'll come up with some great learnings that will benefit our efforts towards the elimination of cervical cancer. I should also thank the organizers of this great meeting. My team in Ministry of Health, Dr. Masarat and MCH team are doing great on this specific matter. I should thank them. And I will also thank the coalition, ISOGA being part of this important platform. I should thank them. ISOGA has been working with us in a number of areas. All our partners who are here, including WHO, your support was really great. And thank you very much. And next, in Ethiopia, we have great gatherings in the coming days and in the weeks. We have 2 big celebrations which will happen soon. One is the Meskel holidays, a very big holiday that we celebrate in Ethiopia. We have also another big ceremony called Irrecha. So I will invite most of you to stay just few days and to participate on these big holidays, and you will learn how much Ethiopia is a great country with a great history. Thank you very much. Thank you so much.
Thank you very, very much for these nice words for opening this meeting. And indeed, I think we still have a lot of work ahead. So in order to spare some time, I would just say a few words of welcome and opening about the Secretariat. So this Symposia series, it's the first time we managed to have it in person. So it's really great to be here and to start this meeting. Just a few words about the aim of the symposium, and I'm not going to discuss too much about ourselves. We are just facilitators. At a certain moment, somebody said for the save the date announce there are 4 logos of companies or institutes or organizations that are not based in Africa. I said, but that's definitely a mistake. So I think it's about the people that are here, the stakeholders from Africa, and the discussions that they are able to take. So this is really about creating and management of a strengthening platform to amplify voices of the Global South in shaping HPV vaccination science, policy, and program dialogues. So we really want to have a community of practice where we strengthen, equip, and empower the HPV community of practice, and where we also look to build consensus on evidence for practice programs and research priorities in the South. We had already one technical meeting online due to the pandemic, and this is available on our website, where you can also have access to the presentation. So this was a focus on Kenya, Nigeria, and Tanzania. So this is just for your information. So this meeting we are having now here in Addis, just a few words on how we prepared for this meeting. First, we did the stakeholder analysis. So we looked to all organizations and stakeholders in countries where HPV vaccination was introduced or planned. And that gave us more than 200 contacts. All of these contacts were invited to submit abstracts, and we also asked our stakeholders to further distribute this call for abstracts. So we had about 200 contacts and about 20 submissions, of which now two oral and 4 poster presentations are presented here at the meeting. The objectives of the symposium is really to share experiences and lessons learned, to discuss the evidence-based policies and program implementation in and across countries, and to contribute to the research agenda to accelerate the progress in HPV vaccine introduction, access, and program optimization, restoration, and sustainability. We also want to discuss new developments in the field and health models that can be integrated with HPV vaccination programs. We want to provide updated information on available data on HPV vaccine evaluation, and which includes also schedules. And we want to discuss the integration of HPV vaccination programs with adolescent health series. Before I give the word to the chairs of our SPC Secretariat, just a few housekeeping announcements. So there you will find a mic on most of the tables. If you have a question, it's better to raise yourself that everybody sees who's asking the question, or come to the front if you don't have a mic on your table. Please note that this meeting is being recorded. If you don't want to be on the videos, I would ask you now to raise your hand, and our technicians will take care that you're not in the picture. But if not, I don't see any hands raised, so that's good. The idea is also to make this meeting available on the website afterwards. And I think we also have to be aware of the time. So there will be some discussion time today, but we will have breakout groups also tomorrow. And I think that is also an occasion where we can further discuss. And of course, also there are the health breaks, lunch and dinner, where we hope to create the opportunity to interact. The online participants, if you want to interact, please switch on your video, and for the rest, keep muted if you're not interfering. Okay, so and in the breakout groups, maybe I just want to mention it. So tomorrow we have 1 hour time where we will have 3 groups. And the idea is we wanted not to pre-feed you with topics. I think we have a lot of discussions, and we will interact with you this evening or tomorrow morning to really select topics that we feel are important to be discussed further during this meeting. And with that, I would like to give the word to the co-chair of the SPC Secretariat, Dr. Nelly Mungo, to say a few words. Thank you.
Good morning, delegates. Good morning. Just to begin by thanking you for coming to this meeting. I was with several people in Kigali, and many of them were heading this way, so it's a long time away from your families, and it's a sign of your commitment to the membership and the work in prevention of cervical cancer. Thank you very much. So I'd also like to greet the Minister for Ethiopia and thank him for the honor of opening this meeting and the work and the words that he talked to us about, and congratulate Ethiopia for the work they've done and the uptake on that African map. It's amazing where Ethiopia is. Congratulations. Some of us are watching you closely and we're learning from you, which I think is the body of this meeting, is when we sit in our individual countries, we're wrangling and we're working in our teams, asking how do we reach these numbers? And this is a forum we can speak to each other during the sessions and outside the sessions. I wanted to say this, that for many years, my background is gynecology. I was always concerned that the HPV work going on globally, research, did not come to our continent. You know, the primary proof of concept studies were done in Europe, right? The HPV testing work was done in Europe, but the vaccine has made a difference, because the vaccine is something we can all deliver, and it's what's made the difference towards where we are now talking about elimination. So this is something we can do. And it's also made it possible for us to look more keenly on the secondary prevention pieces. So when I heard that Ethiopia has screened 500,000 but your treatment of screen positive is 90%.
Yeah, treatment.
Amazing. Because the data across the continent is between 30 to 40% for screen positives. So as we sit in this audience, we have work to do. And I want to really thank Sheikh for making sure that we are talking to each other across disciplines, because I know in this room we have people from the vaccine programs, we have the clinicians, we have the oncologists, we have the scientists. And as I was looking on the program and thinking through some of the discussions we've had, I thought, when will we bring in the Ministry of Education? Because they're the ones who are the custodians of the children we want to vaccinate. So I don't know where we link up with them, but we're moving towards being holistic in our approach, and I think it's shown in this meeting. And maybe as we sit and talk to each other and talk about our community of practice, when we think about implementation, we'll need to also think as a community of practitioners how we will bring everybody in. Every time I talk about cervical cancer, as a scientist, our business is always to find new evidence. But this is one disease where evidence is surmountable, you know. We said we wanted low-cost tools to diagnose cervical cancer. We have them. We said we needed vaccines because vaccines are what we need for elimination. We have vaccines. And we have treatment for early cancer. And everywhere I work in forums now, I think almost all countries have gynae oncologists. So our work is delivery. And I want to challenge us, myself included, SHIC program, the minister, and our ministers who are not here, that we have a duty to move that science to where women can benefit, right? And I want to stop and say that saving women's lives is important. It sounds like a simple statement, but we know that when you save a woman's life, when she's healthy, then you can have a healthy family. And we can have a healthy nation. So we have work ahead. And I also want to say that I'm very humbled with the work that we do in SHIC and the HPV, IPPV. I also wanted to mention that the International Papillomavirus Society has excellent webinars that they post often. So I hope when you get those emails, you circulate them widely. But recently, they also had a decrease in membership for the equivalent of 1,000 Kenyan shillings, $10. So I hope we also engage and extend our educational opportunities. And I'm almost always truly humbled when I sit on the same table with Margaret Stanley, because I have a poster, she doesn't know this, when she won her Nobel Prize in my office. So to even do this introduction and have my name next to her, I am humbled. So thank you very, very much, and I wish us all a successful meeting and successful work ahead. Thank you.
Thank you so much, Nelly. I think the minister and Dr. Mesret have to leave for another meeting. So thank you very much for opening this meeting and your support to this initiative. Then I would like to ask Margaret, who is joining us from London, to say a few words. Margaret, the floor is yours.
Thank you very much, Alex. And let me apologize for not being with you in person, but things have not worked out so that I can move. But this is a really important symposium for all the reasons that the minister and Nelly have given. And I want to point out that the vaccine actually works. We now know that it does prevent cervical cancer because the data from the UK and from Scandinavia shows there's virtual elimination of cervical cancer in women under 30 who have received the vaccine. And women under 30 because that's the oldest cohort we have that have actually been vaccinated. So we are engaged in an effort which will remove cancer which devastates women. And just to reinforce Nelly's message, when you save a woman, you save a family. you save children, you give them hope, and that is the most worthwhile of activities. And Africa has the tools, it has the people, and it has the motivation. And I can only urge you to talk to each other and be encouraged and inspired by the efforts of this symposium. So welcome, and I look forward very much to the next 2 days.
Thank you very much. Thank you very much, Margaret. And then I would like to invite from our co-host, the Federal Ministry of Health of Ethiopia, on behalf of Dr. Meseret Seralam, Mr. Johannes, to say a few words from the Ministry of Health. Is that okay? If you want, yeah.
Thank you very much. I would like to say welcome to Addis. This event is very important for us, and especially for women who are suffering with cervical cancer. There's a future for our generation. Good when you have a big for HPV as well as in screening and the treatment. So I hope all these colleagues who are gathered from the continent, from the world, will have a good deliberation to improve the cervical cancer preventions, as well as, working on HPV vaccination, screening, and others. So thank you very much, and I can say welcome, and I wish a good deliberation on behalf of our director. Thank you.
Okay, thank you very much, Hans. And I would like to invite our other co-host, the Ethiopian Society of Gynecology and Obstetricians, to say a few words. So please.
Good morning. I would like to thank, on behalf of ISOG, State Minister Dr. Rajay Duguma and Dr. Meseret and the whole team from Ministry of Health for opening this important international symposium. So let us give applause. So, dear honorable international and regional delegates, dear colleagues and friends, on behalf of the Ethiopian Society of Obstetricians and Gynecologists, I would like to welcome all of you to this important international symposium addressing HPV vaccination programs from pre-introduction planning to restoration and sustainability, being held today and tomorrow in Addis Ababa, Ethiopia, in collaboration with the Ministry of Health, Ethiopian Society of Obstetricians and Gynecologists, and the Coalition to Strengthen the HPV Immunization Community. ISOG is a 31 years old professional society which has been involved in promotion and enhancement of maternal and newborns and sexual and reproductive health through evidence-based cohesive action of the society with active participation of its members and broad international and national partnership. ISOG is one of the strongest society in Africa in managing and implementing different MCH-SRH projects for the last 31 years. ISOG members, in collaboration with Ministry of Health and concerned stakeholders, have developed a guideline for cervical cancer prevention and control in Ethiopia, which has been published in 2001, available on the Ministry's website. ISOG would like to contribute to the national efforts in the prevention and control of HPV infection and strongly advocates all eligible girls and women should receive HPV vaccination to prevent the second most common cancer, which is cervical cancer among Ethiopian women. Using this opportunity, I would like to call upon all partners to partner with ISOG in order to contribute to the national efforts in preventing and controlling HPV infection in Ethiopia. I wish you a successful today symposium where you are going to share experiences. Thank you very much.
Thank you very much for that nice introduction. I just want to mention one thing on the program, and it has been discussed already. There are 3 pillars in the elimination goals, and during this meeting we will focus on vaccination, but this does not mean that we disregard the other goals. I think they are equally important, but just because of the sake of time we will focus during this meeting on vaccination. But I think there will be some talks on integration, but it's just to notify that that this meeting is mainly focused on vaccination. Before going to the next session, I think it's important that we all know, and I know we are running a little bit over time, but I think that everybody just presents themselves. Please keep it brief, your name, your organization, and your country, but that we know who's in the room and that we can, during health breaks and lunch breaks, can further interact. So if there's a mic that can start somewhere, and we can just say our name, our organization, and our country, so that we know who is in the room. And also we will do the same thing for the people online. Maybe we can start over there, yeah. Okay, thank you very much.
Good morning, ladies and gentlemen. I am Kwame Ampo-Sancha, the manager of the immunization program in Ghana.
Good morning, everyone. My name is Lucy Carrier from Kenya, representing JSI.
Good morning, everyone. I am Christian Miano from the Ministry of Health, Kenya, National Vaccines and Immunization Program. Thank you.
Good morning, delegates. My name is Michael Valerio. I'm representing the National Cancer Control Program, Minister of Health, Kenya.
Good morning. My name is Kelly Kapile, and I am representing JSI. I am also based in Senegal.
Good morning, everyone. This is Sakana Shiratu from Ministry of Health, Ethiopia, National Health Program.
Good morning, William Mange from WHO Country Office, Tanzania.
Good morning. It is Hakam from Ethiopia, Minister of Health, Immunization Program Expert.
Good morning, Victoria Chu, Johns Hopkins University. Good morning, Zoe Diaz with the Gates Foundation.
Okay, good morning. I'm Rag Youth and Specialist of Communication. I represent UNICEF Center. Thank you.
Good morning. My name is Tereje. I'm from WHO Country Office.
Good morning. I'm Asaf Nanda. I would like to welcome you all. I'm working with the Country Office on immunization. Thank you.
Good morning, my name is Dr. Masoud. I'm working in the WHO Office, Ethiopia. Welcome.
Good morning, I'm Chisopa Eric from Ministry of Health, Zambia, representing the National EPI Manager in the EPI Office. Thank you.
Good morning, my name is Elizabeth Mshinga, coming from Zambia, Japai Country Office. Thank you.
Hello, ladies and gentlemen. My name is Montana from Ghana. The country support team.
Good morning, everyone. My name is Sabrina Chitaka. I am a pediatrician and an adolescent health specialist from Makerere University in Uganda. Thank you.
Good morning, Matheus Santosho from Johns Hopkins University in the US.
Good morning, everyone. I am here from the University of Antwerp, and welcome to everyone.
Good morning, everyone. My name is Noshanta Rose Lamini, and I'm the Deputy WHO Country Rep to Ethiopia.
Good morning, everyone. My name is Anne Corey. I'm a research scientist at the Kenya Medical Research Institute in Kenya.
Good morning, everyone. My name is Masat. I am from the WHO Inter-Country Support Team based in Zimbabwe, work as immunization advisor.
Good morning, everyone. I'm Amadine Kinde from the Gambia Ministry of Health, expanded program on immunization.
Good morning, everyone. I'm Marciana Onono from Kenya, from the Kenya Medical Research Institute.
Good morning. My name is Amelia Kibufi. I'm from Mozambique, and I represent ABI, Ministry of Health.
Good morning, everyone. My name is Dr. Linda Lodge. I'm from Kenya, and I work for the Kenya Medical Research Institute.
Hello, everyone. I'm Michael Schlein from Johns Hopkins University in the U.S. and President Secretary.
Good morning, everyone. My name is Ellen Neal. I'm representing Johns Hopkins University in the United States.
Good morning, my name is Molly Sauer. I'm also from Johns Hopkins University in the US.
Good morning, my name is Sarah Byrne with the Gates Foundation in the US.
Good morning, everybody. My name is Abdul Mangesha. I'm from the Addis Ababa University Department of Statistics and Gynecology today. I'm here representing the Ethiopian Society for Statistics and Gynecology. So, thank you.
Good morning, I'm Geto Michungu from Malawi, representing Jamaica office in Malawi. Thank you.
Good morning, everyone. My name is Marie-Amy Lamunashuti. I work with the WHO Afro in the Africa Center. Thank you.
Good morning, everyone. I'm Batule, also with WHO East Africa at the GI Center. Thank you.
Good morning, everyone. My name is Manus Bogale. I work for the Ministry of Health, HPV for 5%. Thank you.
Bonjour à tous, je suis le Dr. Yossam Massimo, je viens de la Côte d'Ivoire, je représente le programme élargi de vaccination. Merci.
Good morning, I'm called Fiona Tebe, the technical lead for new vaccine introductions at the WHO Region of East Africa.
Good morning, ladies and gentlemen. My name is Jiwale Alfred. I'm the program manager for EPN in Uganda.
Good morning, everyone. Good morning, women. Everybody say good morning. You don't even respond. Good morning. Good morning, men. Good morning, men in this room. Yeah, I'm Dr. Mary Roscoe-Jetus, and I'm using Chopaiko, Tanzania.
Good morning. I am Florian Tiluga from Ministry of Health Tanzania Immunization Program.
Good morning, everyone. I'm Edina Ponce Costa, and I work with the Vaccines for Africa initiative based in South Africa.
Good morning, colleagues. Welcome once again. This is Johannes from Ministry of Ethiopia, EPI Manager. Thank you very much.
Good morning, everyone. I'm Melanie Shokolen from Sabata Friends Office, Oromia Region, Ethiopia. EPI for Partners.
Good morning, everyone. This is Vlad. I'm painting Mr. Festival.
Good morning, everybody. Okay, my name is Sarah Almariki. I'm working with the Chicago Optimal. So glad that you could all make it for the meeting today. Thank you.
I'm Dr. Joseph. I'm a lecturer in health research at Makerere
University. Also, as a practitioner. Nice meeting you all.
Good morning, everybody. My name is Chris Morgan. I work at Chicago in the US office and also represent the HPV Council.
Good morning, everyone. I'm Rosemary Njogu, working with Tobago, based in Kenya. Thank you.
Good morning, everybody. My name is Tosin Ajayi from Child Global Vaccine Delivery Team. I'm based in Nigeria.
Good morning, everyone. My name is Raul Sota, representing Chai Global Vaccines, and I'm based out of Kigali, Rwanda.
Good morning. My name is Denmark Segeza from Malawi Ministry of Health in the EPI program.
Good morning, everyone. I'm Thomas Silwe. I'm a peer coordinator from GC District, Malawi. Thank you very much.
Good morning, everyone. My name is Ricardo Gutiérrez from the University of Antwerp.
Good morning, everyone. My name is Fakunauda Bello from Nigeria. I work for the EPI program. Thank you.
Good morning, everybody. I'm Amina Abdul Mohammed. I work with the Nigerian Care Program. I'm the NITAG Health Secretary. Thank you.
Good morning, everyone. So my name is Dr. Ivan Ketan. I came from Chicago, Liberia.
Hello, everyone. My name is Martin Zep, and I work on the Chief Secretariat.
Good morning and welcome, everyone. I'm Malcolm Magalo from Ministry of Health Ethiopia, National Immunization Program.
Good morning, everyone. My name is Hiroki Akaba from WHO headquarters Geneva. I'm the Department of Immunization and focal point of the HPV vaccination. Thank you.
Good morning and welcome to Ethiopia. I'm Sialama from Ethiopia. I'm working for the Federal Ministry of Ethiopian Immunization Council.
Good morning. I'm Anna Molia from the Vaccine Conference Project of LSHCN.
Good morning. I'm Portia Manalazira from Zimbabwe Ministry of Health.
Hello, everyone. My name is Raya Kiesi from the Ministry of Health Immunization Vaccine Development Program in Tanzania. Thank you.
Good morning. I'm Mario Polak from the University of Ghana, Sevilla, Program Committee.
Good morning. I'm Dr. Benedict Catherine Mutonga. I'm an obstetrician and gynecologist in the private sector, but I was also part of the team that actually launched the HPV pilot vaccine in 3 districts in Lusaka in 2013 under the former First Lady's NGO, Mutala.
My name is Dr. Okere Kauji. I'm the permanent program manager from Nigeria. I'm the executive secretary of the Ministry of Government Development Agency. Thank you.
Good morning. I'm Deborah Watson-Jones. I'm from the Mwanza Intervention Trials Unit in Tanzania and also joint affiliation with the London School of Hygiene and Tropical Medicine.
Good morning, everyone. I'm Eileen Mukanyandwi from Rwanda EPI Immunization Program. Thank you.
Okay, thank you for joining.